those that might be providers there to listen and listen very carefully.
Right. Now, the quality patient care is a priority in all healthcare systems. However, patient safety can be compromised, leading to potential medical harm. Medication errors in Uganda's healthcare setting are relatively common, and the impact of adverse drug events is substantial, but many are preventable. Now, globally, the cost associated with medication errors has been estimated at $42 billion annually. To address this situation, the World Health Organization launched a global initiative to reduce severe, avoidable medication-associated harm in all countries by 50% over a period of 5 years, starting in 2017.
Now, dubbed the Global Patient Safety Challenge on Medication Safety, the initiative aims to address the weaknesses within the health systems that lead to medication errors and the severe harm that results from those errors. Now, 3 years down the road after this challenge, the government of Uganda is taking stock of how much has been achieved, challenges that have been faced, and where we as a country stand 3 years later. Now, to have that conversation this morning, we are joined by Dr. Christine Katsime, and she is from the Ministry of Health. Welcome to Morning at NTV, Doctor.
Thank you.
Now, we'll start with where as a country. Where do we stand 3 years later?
In terms of patient safety and quality standards, we've taken major strides as a country. We've had the launch of the National Medicine Policy, which governs the use of medications within the country. We have a National Quality Laboratory at Mulago Hospital, and we also have lots of guidelines that govern the health sector. So in terms of strides, in terms of safety measures, the government has success within the field. However, there are notable gaps. We have a notable gap as of last year, 2018, where we had a big scandal regarding the hepatitis B vaccination.
Correct.
So we have issues where we have situations where we have vaccines that are supposed to be preventing hepatitis B that are actually discovered as being fake. So here is when we tend to ask ourselves what exactly is going wrong, where exactly are the gaps. And then we have a notable voice within the country, Prophet Elvis Mbonyi, talking about this scandal way before it happened. Now, as much as we know that the government has taken steps and is actually closing gaps and actually making strides within the field of safety of drugs, we have a resource within the country that we need to take note of. And it is not that Prophet Elvis is a newbie. These things have happened before. He talked about the Gavi scandal back in 2013. He talked about genetic science engineering and the breakthroughs that would come as a result of genetic engineering, still in 2013. And till this day, we've had talks of diseases like sickle cell anemia actually being cured, and things like Parkinson's disease and things like that. However, when it comes down back to the subject at hand, in regards to drug safety, I think other than the government having a role, the church has a role.
All right.
So we ought to pay attention to the voice in the land. And the voice right now is the voice of Prophet Elvis.
You know, when we talk about errors in medication, it also stems from a point of misdiagnosis.
Oh, yes.
That happens quite a lot.
Oh, yes.
So what is the role of the Ministry of Health to ensure that we know that gap is actually done away with, especially now that if we are to boast, every day the ministry boasts that, you know what, as much as, the ministry or the country is short of medical personnel, but this medical personnel are well skilled, well equipped, then what is the ministry doing that, to ensure that that is eliminated, misdiagnosis?
Actually, in terms of statistics, close to 50% of hospitalized patients within Uganda are actually at risk of adverse reactions due to misdiagnosis or a wrong diagnosis. Now, as much as we have quality standards, we have guidelines, we have the National Medicines Policy, there are still major gaps. Now, when you look at the Gavi scandal, for example, just to bring it to the forefront, we had a situation where the Gavi funds, now Gavi is a Global Alliance for Vaccines. Now, vaccines are an area that no ministry all over the world would actually want to invest in. Why? There is hardly any profit. Now, these funds are misappropriated. Now, when these funds are misappropriated, for us as the medical professionals, we actually knew that we are going to see a resurgence of vaccine treatable diseases, things like poliomyelitis, rubella, measles. Now, suddenly, we get a word from Prophet Elvis Mbonye telling us that the countries that had actually cancelled these dates were actually going to reverse them, which meant that instead of telling a patient that there is actually no drug or we are going to give you the wrong drug, there is actually hope, there is restoration. So at the end of the day, going back to the subject at hand, what should the government do? The government ought to pay attention to a credible voice. And right now, the credible voice that we have seen time and time again in the nation is the voice of the Prophet, Prophet Elvis Mbonye.
You mentioned credible voices,
Yes.
and one would be also the doctors, the
Yes.
nurses, who
Yes.
have time and again said things are not okay on their end.
Yes.
We have seen even from the reports that some don't even show up to work. We have
yeah.
seen the statistics of the number of patients to the doctors across the country being quite spread, and we wonder how is it that even some get treatment at the end of the day and some don't. And that's very key in the quality of patient care.
Yes.
As the ministry, what are we seeing being done on that end in the last 3 years?
Within the last 3 years, there's been certain measures that have been employed by the ministry. For example, task shifting, where we have training of skilled birth attendants, and we have lots of training that is being disbursed to especially medical professionals that are in hard-to-reach areas. However, going back to in terms of beefing up the health sector, there is no point in training health workers when the working conditions are poor. Now, this goes back to what I'd highlighted before, because even as much as I'm trained to probably a master's level or a PhD level, and I'm in a hospital and I'm looking at patients, and vaccines, essential drugs are more or less not available, then it becomes extremely frustrating to the medical professional and also frustrating to the patients. And this goes back to what I'd highlighted earlier. You see, when you have situations where there are drug shortages, where you have vaccine shortages, where you have wrong drugs being given to patients, it's not only frustrating on the part of the patient, because you see, a patient will always come back to the health center or back to the hospital and you will not have a solution for them. So when you have a voice in the nation that is providing restoration, because we had nations like Denmark, like Sweden, most of the nations in the European Union had cancelled up to 57, and other nations had cancelled up to 162 billion in funds, in donor funds to Uganda. Now suddenly, and we all know when funds are misappropriated, the patients pay at the end of the day. However, for us as front runners, whenever you're exposed to patients that are carrying diseases, we actually pick them up as medical professions. So we're also at risk. So at the end of the day, we have a situation whereby we don't have to be made to pay. Because in similar situations where you've had countries that have had misappropriation of funds, funds are blocked and then they are tasked to actually pay back. Then suddenly, Prophet Elvis Mbonye is telling us, oh no, that doesn't have to happen. The funds are actually going to be reimbursed, and therefore treatment will continue as usual. So for us, that restores hope within the health sector. Yes.
Dr. Christine, you know, just being very realistic, you visit hospitals, we all visit hospitals, if not for us, maybe for, you know, a loved one who maybe has fallen ill. And we can all attest to the fact that in a majority of hospitals, the health workers there have this attitude of carelessness, I don't care attitude, very lethargic. What is the ministry doing to ensure that these issues are checked? How often does the ministry monitor or maybe take up such complaints and issues and make sure that this is corrected? Because, you know, it's the same lethargic attitude that is leading us to conditions and situations whereby we are talking of misdiagnosis. If, for example, I go to hospital, maybe I'm not feeling well, they have to take a blood sample or a stool sample or a urine sample to take it to the laboratory to test it. But the person in that laboratory knows what they're supposed to do. They have every equipment at their disposal to make sure that they are accurate with these particular testings. But because someone has this attitude, they don't care attitude, they're lethargic, maybe, you know, discouraged in one way or another, chooses to do their own things, and hence they give the wrong results, hence given the wrong medication, treated for the wrong, you know, disease. And if worse doesn't come to us, if I don't get worse, then maybe I lose my life. And it's the same case that you're seeing day in, day out. So what is the ministry doing about that? Because it's not a matter of having unskilled professionals. They are skilled, but the attitude is wrong.
Thank you. The government has definitely had guidelines and policies that are put in place. Of course, there are checks and measures. And in most hospitals all over the country and in health centers, we have continuing medical education to continue training professionals on the ground, continue training nurses, continue training laboratory personnel, because these are key within the health sector. However, still addressing the issue of lethargy and wrong diagnosis or misdiagnosis, some of these issues actually may stem, and in most times actually stem, from a shortage of equipment, or a shortage of drugs, or a shortage of medicines to give to the patient. Going back to what I discussed earlier, you see, it is high time that the nation began paying attention to Prophet Elvis Simbonye, because it's been proven over and over again. Because you see, if you have a situation whereby suddenly funds to major government hospitals are tied up, then there will be, I mean, it is more or less like you know, it's more or less a frustrating situation. You have patients, you don't have answers to give to the patients. You have doctors, and we seemingly seem like we have the solutions, and yet we don't have the solutions.
But do you take up complaints of such medical personnel, for example? If
oh yes, we do.
Yes.
Oh yes, we do.
What are the consequences, or what are the penalties for such?
Just like I'd mentioned earlier, there had been penalties, for example, that had been given in regards to the Gavi scandal. However, even in the presence of these penalties, because earlier we were going to suffer as a nation, we were suffering as medical professionals, because if you remember, within the season of about July to about the end of the year of 2013, there would have actually been a shortage of vaccines. Now that would mean a resurgence of diseases like poliomyelitis, resurgence of diseases like rubella, resurgence of diseases like measles. Now it is not only resurgence within the patients, we as the health professionals are put at risk. But now, instead of suffering cancellations and penalties, we are told that actually those funds will be restored by Prophet Elvis Simbonye. Then suddenly we are seeing the drugs are back on the market. There is no shortage. We are able to avail drugs to patients, and so that alone is able to curb the lethargy. Because so you see, at the end of the day, if you're lethargic towards a patient, more or less it is because of the working condition you're in, and it is not of your doing. Usually it is the doing of probably something else in the background. So for this particular situation, the working condition, the lethargy, was actually solved by the word of the Prophet.
But then if we go back to just the skills, just the communication skills from within the health sector, if you go to like Mulago, some people have mentioned it a number of times, in the labor wards, Yes, they're overworked. Yes, there's a lot going on, but where does it go back to the training bit of it and how they're trained to handle some of these when they're overburdened, overloaded? The training of when this happens, this is how you should do this. These soft skills, the training of the health workers, how does that usually go? Or do we only look at the fact that we're training you and letting you go out into the health facilities, but telling them of the times that things might be too much for you, but this is how you handle the patients nonetheless?
In terms of handling patients, guidelines, standards are available. Like I'd mentioned earlier, we have continuing medical education in most government facilities, in the private sector. Most of the training is actually available. So in terms of addressing medical errors, in terms of addressing lethargy on the part of the healthcare workers, most of these things are because of issues like drug shortages, drug interactions, funding blockades, and most of these, like I've earlier said, and I will not really waver from what I've said earlier, these have been addressed by the voice in the nation, which is Prophet Elvis Mbonyi, and we ought to actually pay more attention to what he's saying to us in this day.
Okay, as we come to a close, just in case we have viewers who are watching us today and they need to know, if I go to a hospital, I'm mistreated or mishandled, can I troubleshoot? Can I, whistle blow, so to speak? Yes. So what are these avenues that the public can actually interact with the ministry?
In most hospitals, especially in government hospitals, there are heads of departments. So most of the heads of departments actually receive complaints from patients. I have been at the forefront of inpatient care, and most of the heads that I've worked with actually receive complaints, and they do receive them anonymously. Because you see, sometimes some of these may be as a result of maybe a patient hasn't received a certain kind of medication because it is actually in short supply. So when a patient reports something like this, the head can be able to guide them accordingly. Now, some of these complaints are actually discussed in board meetings. These complaints are actually addressed in departmental meetings. So the avenues, the pathways are actually available. Yes. So
if I go to the head of department and they do nothing about it,
head of the ward, the nurses, the pathways are there, the departments are there in almost every hospital I've been to, even in the private sector.
And if they do nothing about it, can I directly address my issue to the ministry?
Oh yes. At the ministry, we have actually a department that is in charge of patient care and quality and standards. So we are actually available to taking the complaints of patients. And like I said earlier, most of these things, because of certain things, either due to shortages, drug shortages, and if these are actually raised at the ministry, these can actually be addressed. Yes.
All right. Okay. Thank you so much, Dr. Christine, for coming in studios. At least now you know, just in case you raise an issue with the hospital, the head of department, and they don't take it up, you can directly address it with the Ministry of Health. Thank you so much for coming in. So that's it for this particular segment. Don't go too far. Morning at NTV still continues.
Oh, sorry.
Ramadan Minute is brought to you by...
At the New Bay, we create the home you love with our luxurious furnishing and